So next we have Jaeyoung Ha, who is Jaeyoung Ha, who is a doctoral student at the Graduate School of Public Health, Seoul National University. Her primary research interest is in health equity in health equity. In 2022, she presented a study on the unequal effects of the COVID-19 social distancing policy by socioeconomic status measured by the Regional Deprivation Index in South Korea. Recently, she has been studying the relationship between multidimensional well-being as flourishing, encompassing physical, psychological, and social health, and social structures and institutions. As a member of the Tobacco Endgame research team, she has focused on the political and social structures and environments as perceived by government officials and practitioners. As part of this research, Jaeyoung has conducted a stakeholder mapping study of current and potential stakeholders in South Korea and plans to introduce the findings from that study here today. Thank you.
Thank you for the lovely introduction, Dr. Kroll. It's my great honor and pleasure to be here, and I would like to begin the presentation by acknowledging the tradition and the owners of this land. I also would like to pay my respect to the elders past, present, and emerging. This is my first trip to Brisbane, and I fell in love with this city and country. I would also like to express my gratitude to all of my colleagues from South Korea, and the series of this research work, which will be presented in the later session as well, stems from the research project strategies, and task for the development of the Tobacco Endgame roadmap. And especially I want to thank to Dr. Kang, who led this research project on behalf of our team members. Without her passionate and warm leadership, I wouldn't be here today, and happy to learn from all of you. Okay, before I begin my presentation in earnest, I would like to declare that this study was supported by the Korean Health Promotion Institute, and we don't have any competing interests. The first endgame attempt in South Korea is often cited as the proposal to prohibit tobacco manufacturing and sales, which was submitted in 2006. However, the petition was abolished without even being discussed, along with the dissolution of the 17th National Assembly. This led me to think why, and I realized the need for a basic understanding of the socio-political landscape related to tobacco policy, which became the motivation for this study. Based on the steps of stakeholder mapping analysis, our research aims to identify key stakeholders and their characteristics and derive potential challenges and implementation strategies. This work is particularly important at the policy formation and legitimation phase of the policy process, as it allows us to predict major entities who are likely to oppose or support the policy and develop strategies to increase support. Additionally, we can gain a better understanding of the political environment surrounding the endgame policy, especially to South Korea, which can help policymakers utilize this information to develop strategic communication and advocacy plans. We conducted 11 in-depth interviews of participants from government officials, civil society organizations, and academic researchers. And the data collected were analyzed through mainly the content analysis, and there were three characteristics of the stakeholder used in this study. First one is about position, which refers to whether the stakeholder supports or opposes or is neutral about the policy. And second one is the political influence, which refers to the potential ability of the stakeholders to affect the policy. And the last one is the engagement level, which was operationally defined in the study, refers to the level of direct political activities and involvement in exerting political influence, such as protest petitions or even generating evidence. So the three characteristics that I mentioned earlier of the key stakeholders were described in the diagram. Position was indicated by color, which is red in opposition and blue in supportive. And the political influence was indicated by the size of the figure, and the engagement level was indicated by the position within the contour lines, which means if it is closer to the center, the higher the engagement level. This diagram is structured to clearly display the opposing and supporting faction. Actually, I think Dr. Fong has mentioned about the battlefield. So I tried to make it like a chessboard to provide a clear view of political landscape at a glance. So you can see the structure and interrelationship among the entities from the diagram. So firstly, on the opposition side, we found that the key stakeholders are consolidated by strong economic interests, with tobacco companies at the core of the alliance. Tobacco companies were highlighted as the key stakeholders in the most powerful opposition group. And interestingly, they perceived them exerting political influence indirectly by using other actors such as retailers and farmers as fronts, which was mentioned in the keynote speech yesterday that retailers are backed by tobacco companies quietly. Another interesting find is that participants perceive the Ministry of Economy and Finance to be on the opposing side of endgame policies, wielding significant political influence due to economic motivations such as tax revenue. In the special context of South Korea, where tobacco products are earmarked taxes, this tax revenue become a significant considerations for some governments, such as local governments, in particular, highly depend on the tax revenue, making them the potential opposing entities aligned with the Ministry of Economy and Finance for economic reasons. And we found that further studies are needed to uncover the flow of the tax revenue in South Korea and identify which entities benefit the most from this revenue. On the supportive, I made some animation here. So on the supportive side, we found that the structure is unorganized without leadership entity. The Ministry of Health and the Korea Disease Control and Prevention Agency were recognized as supportive stakeholders. However, their political power compared to the Ministry of Economy and Finance is perceived as low. Alongside these ministries, the Ministry of Environment and environmental organizations were perceived as potential supportive stakeholders, especially if there is increased awareness about tobacco's environmental harm. Another interesting finding is that families of tobacco users, and particularly parents or parent association in a more organized form, were highlighted as potential stakeholders who could become strong advocacy groups for endgame policies. I will explain in detail in the next slide, which links to the implementation strategies. Throughout the stakeholder mapping analysis, we found that mobilizing the public is paramount for achieving the tobacco endgame. Particularly, it was highlighted to organize an advocacy coalition that actively involves key stakeholders. In fact, from our interviews, participants argued that the effective advocacy coalition should have the Ministry of Health and Welfare at the forefront, empowered by civil societies, including parents and families of tobacco users. However, from what I learned in the keynote speech yesterday, I believe we could mobilize the public as the driving force to shape their own policies. Another point I want to highlight is the importance of framing and communicating values such as youth protection to garner public support. This approach can counteract the economic motivations that often drive opposition. So for the conclusions, I derive barriers and implementation strategy from my analysis. The first one is opposition groups were perceived as being strongly connected economically to tobacco companies at the core of their alliances. In contrast, advocacy group pushing for tobacco endgame was perceived unorganized and lacked prominent leadership. Tobacco companies have sponsored industries and retailers and employ tactics to promote a positive brand image to influence the public opinion. And for the implementation strategies, public support emerged as the most crucial element in Endgame policies. And an organized group of proponents supported by the public will play a crucial role. And for the last strategies, value-based messaging, such as youth protection, is vital to consolidate policy support as a driving force the Endgame policies. So that's all from me. Thank you for your listening.
Any questions for Jaeyoung? Up there.
That was really, really cool. I love this whole map. I found it really useful and brought structure to the discussion. I have a question. The Ministry of Health that weren't very influential, how do they react when you tell them that? Do they want to be more influential? And how can researchers like you make the Ministry of Health more influential? Because your recommendations were largely about increasing public and youth support through civil society. Great. But well, my question is there any way to make the Ministry of Health more supportive?
Thank you for your question. I think I should sleep on it more, but I believe that links to the role of public health itself, I think. I think that is the accountability of our public health authorities to protect the health of the population and their rights to be healthy for all population. So I think we can alert them. It is their accountability to protect the health of our people. And also, I think that's why I think the mobilizing the public support and then keep alert them by monitoring or by surveying how people think about their health and then what they have to do for that.
Any other questions? Yeah. I've got one. So I noticed you've got on there families of people who use tobacco and people who don't use tobacco, and you've got parents on there. What about people with tobacco-related disease? Do you think they have a role to play in here as a stakeholder?
Yeah, actually, it was mentioned during the interview, but because I analyzed the data through the content analysis, which is based on the frequency of the response pattern. So I didn't put it in there. But actually, I agree with that idea. And then absolutely, there are some families or caregivers that worrying about their family should be in those groups.
Any other questions? No? Okay, well, I will thank our speakers. Thank you very much.